Vital signs. So we're going to go over today all the different vital signs throughout the body and how to measure them and what to do about them and what they exactly mean to everyone. So we use these to assess the different conditions in the various body systems throughout the body, particularly the respiratory and the circulatory system. Our whole goal within the body is to maintain homeostasis. Homeostasis is the state of equilibrium within the body. So our whole point is to maintain this equal level. It should all be about the same. We want to have a consistent internal environment, and we have to be able to compensate for changes that are going to cause it, and then how is the body going to react to it. The brain's going to monitor this, and it basically sends out signals to change the body systems to adapt to the internal or external environment changes. The signs that when vital signs change, it basically shows us that the body's unable to change and therefore reaction to injury or illness. So there's 5 basic vital signs: pulse, respiration, blood pressure, temperature, and pain. So for example, we're looking at what would change. So we got to measure it correctly. We got to have routine, and we got to be the same. So if we had a low oxygen level because maybe we couldn't breathe correctly, then we're going to have an increased breathing rate because we're trying to get more oxygen into the body. So the body system adapts as it goes through. So starting with pulse. So this reflects the circulatory system and cardiac function. Now, a pulse can only be found in an artery. It cannot be found in a vein. So you got to make sure you're finding an artery, not a vein. And a change in pulse is going to change patient statuses. And obviously, absence of pulse is clinical death or cardiac death. Remember when we talk about circulatory system, the main components, it's the heart and the blood vessels. When I say blood vessels, we're talking about arteries, capillaries, and veins. Arteries are oxygenated blood going away from the heart, and veins are deoxygenated blood going back towards the heart or the lungs to get more oxygen. Capillaries distribute said oxygen, and they're the smaller, more paper-thin blood vessels. So the blood passes through these capillaries and arteries at a quicker rate than the veins because it's being pumped from the heart, and that's why you can feel the pulse in the arteries, not the veins, because it's the pulse. It's how fast your heart is pumping. So for example, a rapid but weak pulse can indicate shock or bleeding or diabetic coma or rapid or heat exhaustion, but a rapid and strong pulse might indicate a heat stroke victim or severe fright or pain. And a strong but slow pulse may indicate a skull fracture or a stroke, and an absence, like I said, is arrest or death. So pulse equals heart rate. So when you listen for a heart rate, you're going to palpate to an artery, and you're going to use 2 fingers. You're going to use 2 fingers, not your thumb, because your thumb has an artery, so you have to use your first 2 fingers. And then you're going to find it. Now, a normal pulse rate for an adult is between 60 and 100 beats per minute. For children, it's a little bit faster, 80 to 100. Now, if you're an athlete or someone that's extremely fit, you're going to have a lower heart rate. If you're not extremely fit, you're most likely going to have a higher heart rate. So there's those kind of things to take into consideration. Also, when we say tachycardia or someone's tachy, that means their heart rate is incredibly fast, so above 100. Brady or slow, bradycardia means it's very slow, so it's below 60. However, like I said, a conditioned athlete could have an average 50 to 60 beats per minute because they're in shape. You're also going to look at the rhythm. Is it regular or irregular? Meaning, is it consistent or is it irregular? And also you're going to look for refers to strength of the pulse. Like, is it weak? Is it strong? Is it thready? So weak and rapid. Is it bounding? Meaning it seems like it's almost bounding out of the skin, like super strong. We want to look at rate, rhythm, and strength to help with medical conditions. It can be felt in many places and easily in many places, but the most common is radial pulse and the carotid pulse. If pulse is not detected, that's when CPR, cardiac Cardiopulmonary resuscitation comes into factor. So when you feel for radial pulse, you're going to look for the artery at the base of the thumb using 2 fingers. And one way to do it is just like the picture shows, finding it that way. Or another simple way is if you wrap your hand around your wrist and your fingers come up from behind the back of your hand around your wrist, it's an easier spot to find as well. Your carotid artery, most easily it's found if you start with 2 fingers at the top of your jaw, at the point or the corner of your jaw, and you basically slide down and forward into kind of that nook of your neck, and you can feel your carotid there as well. You can also feel it in your temporal artery. It's typically not used because it's difficult to find. Your brachial artery, which is on the inside of your arm. Your femoral artery, which is up in your groin region. We use this a lot to check for decreased circulation in the legs. Popliteal artery is in the back of the knee. Dorsalis pedis artery is in the foot. It's commonly used to check circulation in the feet. And your apical pulse is at the apex of your heart. When I talk about brachial, that's what we talk about when we talk about stopping the blood, finding the brachial artery right in between your muscles. In the dorsal pedis, it's just on the top of the foot, and you want to look for that. That's how they determine if you have a decreased circulation to your foot. Now, how can you raise your pulse? Caffeine or any type of stimulant is going to raise it. Dehydration is going to raise it. Stress, tobacco, and fitness level. So dehydration, it could be because you consumed caffeinated beverage. So it's not always just the liquid that you consume. You got to realize what you consume. Did you drink a lot of coffee versus a lot of water? That's going to affect you differently. And also, caffeine dehydrates you even though there is liquid involved. So a mild to moderate usage doesn't seem to increase irregular heart rhythms or arrhythmias. But a large amount a day can cause that. Sometimes people will say, oh, I've had too much caffeine, my heart's pounding, or irregular heartbeat. That's what they're talking about. So loose fluids, so when volume of blood decreases, the heart has to work harder and to circulate the same amount of nutrients, so therefore it beats faster. We all know when we're super stressed or worried, we can increase our blood pressure and increase our pulse rate because we're just stressed. It's part of our fight or flight symptom. And tobacco or chewing tobacco can increase our blood, our BP as well as our pulse, simply because of the narcotics involved. Fitness level lowers it. Sedentary lifestyle affects it and raises it. So depending on where you are on the spectrum of fitness, that can definitely fix it. So when you're measuring radial pulse, you don't need a lot. You just need a digital watch or an analog watch with a second hand. If there's bodily fluids present, you always want to make sure you wear gloves. Make sure you wash your hands. So introduce yourself just like before. Have them sit or lie down depending on the condition. And then you're going to measure it and make sure you get confirmed consent. Explain what you're going to do. Step 1, step 2, step 3. You're going to find the pulse, then you're going to look for the pulse, and you can count to 30 or watch the clock for 30 seconds and multiply by 2, or some physicals do 10 seconds and then count, multiply it by 6. Depends on how long you want to hold it, but it's beats per minute, so whatever it is, it's got to equal 60 seconds. Then when you're done, you're going to note the rhythm and quality. So for instance, 65 beats per minute, strong rhythm, and no irregularities. So we want to know what's going on. So irregular or thready if it was, or quick. Then remove your gloves, note it down. If there's any type of problem, make sure you report it to a supervisor or EMS if there's something strange. Now for respiration, we're talking about breathing. So we're counting the breathing, how hard they're breathing and how much they're breathing and the speed at which they're breathing. 1 respiration equals 1 inspiration, 1 expiration. So inhale and exhale is 1 respiration. This is how we're getting oxygen into the body and releasing the waste product. This is also controlled by the brain to decrease carbon dioxide levels within the bloodstream. And it's going to allow for energy to be performed, and exercise to be happening. So general guidelines, traditionally, it's 15 or 16 to 18 beats per minute in an average person. However, if you're well trained or have high lung capacity, it might be much less, so 6 to 8. Also, it could be higher if you have a hard time breathing or maybe you're asthmatic. So when you want to measure this, you want to look at all the respiratory patterns. So is it coming from the abdominal area, which means respiration's using abdominal muscles to breathe. Apnea, it's when you stop breathing. So you probably heard of sleep apnea. So literally people pause while they're breathing. Bradypnea means slow breathing, so it's abnormally slow. Cheyne-Stokes is grossly irregular, so intermittent periods of apnea from 5 to 30 seconds and basically causing irregularities. Decreased meaning very little air movement. Dyspnea means difficult or shortness of breath. Basically means painful to breathe. Tachypnea means basically it's faster or hyperventilation. Labored breathing, it's difficult. Maybe they're using their shoulders to breathe. It's hard to breathe. And Kussmaul's deep breathing is gasping. Basically like for your hunger for air. They're gasping for air. So the volume of air exchange with each respiration is determined by looking at the patient's chest. You can put your hand on their chest and you're seeing how their chest is rising and chest is falling, the inhalation and exhalation. So volumes described as deep or shallow, characterized in terms of cycle regularity and breathing sounds, difficulty breathing, sit up and lean forward, confusion, restlessness, skin's turning cyanotic, meaning it's turning blue. So when we say someone has deep breaths, they're taking long, high volume breaths. Shallow is when it's very shallow, very quick, not deep breaths. Someone can possibly hyperventilate at this point. And you're looking for 1/3 to 2/3, 1/3 expiration and 2/3 prolonged inspiration. So if anyone's ever had any type of asthma, a lot of times people will recommend when you're breathing in, count to 5 and breathe out, count to 10. That's what they're looking for. They're trying to get you to slow down your breathing and slow deep breaths. Irregular cardiac breathing can cause or be caused by cardiac involvement or metabolic abnormalities. Normal breathing should be rather quiet and effortless. If it's noisy, there's most likely some type of obstruction. So when you're measuring respiration, wash your hands, and you're going to tell them what we're doing, wear gloves if body fluids are present, identify yourself, identify the patient, and you want to tell them what you're doing, but you don't tell them when the monitoring will start because people will hold their breath or try to do something different. So you want to try to maybe do it, say, hey, I'm going to take your pulse and your breathing rate and explain to them what's happening, and then maybe do pulse first and then breathing, so they don't really know which one's happening at what time. So you get a true answer of what's happening. You're going to count for 30 seconds and multiply it by 2, just like the pulse. And then remove the gloves, wash your hands, record the results and any type of description. And then also report it if necessary if there's difficulties. Blood pressure. So this is the measurement of the force of blood that's exerted against the walls of the artery. There's 2 measurements. There's the systolic and the diastolic. Systolic is when the heart contracts, so it's the hard force, so it's going to be the higher number, okay? So when the heart contracts, it's the top number, it's the higher number. Diastolic is the bottom number. It's when the heart is resting and refilling, so the pressure isn't as high on those arteries. So when we're looking at blood pressure, a term is hypotension, meaning it's low blood pressure. Hypertension is high blood pressure. There's different things that cause this. So it could be amount of blood and other fluids that are present in the body can cause high or low blood pressure. We want to look at age, obesity, pain, stress. All these genetics, gender, all these things affect the type of blood pressure you have. Having a very low blood pressure could lead to dehydration, internal injury, indicates shock, heart failure, heat exhaustion, severe infection. Hypertension, so high blood pressure, can be a precursor to cardiac problems and strokes. Sometimes it's caused by obesity, lack of exercise, too much salt, stress, pain, drugs. There's many different things that can increase it or decrease it, but you want to keep it between that 120 over 80 is kind of that sweet number. Any systolic number below 100 is a concern, or at least to look into, and anything above 139, that 139, 140 is concerning. And diastolic, if it's below 65 or above 89, 90, that's when you become concerned. So like I said, the 120 over 80 is kind of that sweet spot, but there's a little play in there. You're not super concerned if it's 122 over 82, but if it's 139 over 95, now I'm concerned. So how do we measure blood pressure? We measure it with a sphygmomanometer, and you want to make sure it's the proper size. They come in child size, regular, and extra large. Now, extra large, we're talking like the 300-pound type person, like a very large person. Most of the time, the regular blood pressure cuff is perfectly fine. It should cover about 3/4 of the patient's upper arm in diameter. And if it's not the right size, you're potentially not going to get the right reading. That's why it matters. You need a stethoscope and an alcohol prep pad or sponge to clean things, and gloves if there's fluid present. So that is a picture of a blood pressure cuff or a sphygmomanometer. You've all probably seen one, okay? Now, a stethoscope, we've all seen that as well. We need this in conjunction when we measure it, because the sphygmomanometer tells us the pressure at which it's at, but we need the stethoscope to hear when we look at it. So we'll have a video for you to watch for this as well, but at this point I'm just going to verbally describe it. So same thing as before, wash your hands, assemble the equipment, put gloves on if they're present, if there's blood fluids present. Inpatient setting, make sure you talk to the patient, check their name, repeat it back, explain the procedure, tell them what you're doing, the cuff's going to get tight, and when it's inflated, getting consent, then have them sit or lie down, have them roll their sleeve up, because you don't want to do it over the sleeve because it's harder to hear and it's not as accurate. Try to have them extend their arm, palm up, so their arm is rested, relaxed, and straightened. Then you're going to find the brachial artery, place the BP cup over that, smoothly secure it about 2 inches above the bend of the elbow. Use the arrow on the blood pressure cuff to line up with that brachial pulse that you found. And then you're going to use the earpieces of the stethoscopes in your ear. When they're pointing forward, it's much more comfortable. And then you're going to find the brachial artery again and put that stethoscope right over that brachial artery. Now, holding the diaphragm in place, you're also going to close the valve of the blood pressure cuff and squeeze it up to approximately about 150, so you can no longer hear the pulse in your stethoscope. So you're going to look at the sphygmomanometer dial, and you're going to pump it up to 150. If you're pumping and it keeps going back down, that means you need to tighten the knob. Just turn it the other way, all the way, and then when you start squeezing again, it should go up to 150. Then you're going to slowly and steadily open the control valve, very slowly, and you want to hear for the first tapping sound or first heartbeat sound, and that would be your systolic reading. So when you open the valve, it's going to lower, the dial will lower very slowly. And when you hear that first sound, wherever that dial is, that is the systolic reading. So say it's 123, 118, whatever it is, the first time you hear something. Then you're going to continuously, steadily lower the volume, turn the knob so it's continuing to decrease the pressure in the arm until you hear the last sound. So you're going to hear a thud, thump. You're going to hear the heart rate, keep hearing it, keep hearing it, keep hearing it, and all of a sudden you stop hearing it. No, you won't hear it anymore. That's the last sound, so that's the diastolic reading. So that's at maybe 82, 78, something like that. Once you get that, then you can quick release it and remove the cup from the patient's arm. You want to report any abnormalities, note the time, note the position. If you have trouble, switch arms on the patient and see if that helps. Clean your earpieces. Make sure your stethoscope is turned on So most stethoscopes, if you turn the bottom part of the stethoscope one way or the other, it'll be louder or softer. So that's why you always see doctors like tap their stethoscope first to basically see if they can hear it. Then remove your gloves, clean up, wash your hands. Temperature. So that's our next one. So we're going to look at core temperature. So core temperature's got to remain relatively narrow in the range for all the body systems to function. It's regulated by the hypothalamus in the brain, and a group of these cells monitor the temperature of the blood and respond to any changes. If the hypothalamus will send messages to nerves, to muscles to create heat by shivering when the body's cold, or it causes blood vessels to constrict to retain heat. It'll also stimulate sweat glands to start sweating to cool someone off if they're too hot. So a normal body temp is 98.6 Fahrenheit or 37 degrees Celsius. Core readings are more reliable versus oral readings because you can adjust your oral temperature by drinking something or having something hot or keeping your mouth closed or open. So temperature can be dependent. You want to make sure that if you are taking it orally, it's under the tongue or the tymphatic membrane of the ear, or now we all know the surface temperature ones for the forehead or face. And the most accurate is the core temperature, which is obtained through the rectum. So think babies. And this is also what you use when you're looking for exertional heat stroke or any type of heat stroke, because it's the most accurate and we know what's going on. So tymphatics in the ear. I'm sure you probably all had that done at some point throughout the doctor. Oral is the traditional under your tongue. Wait for the beep. So we've all done this, but you've all been to the doctor. They tell you, hey, I'm going to take your temperature. This is going to go under your tongue. And they check your name. They get in consent. Make sure there's a disposable cover. Have the patient discard it. Also, make sure they haven't been drinking anything in the last 15 minutes. And then you wait for the sound, flashing light, whatever it is, and then disperse the cover. Now read it, return the thermometer, and then report anything abnormal. So height and weight. Now I know I didn't list this as a true vital sign, however, it is a health risk and something to take into consideration. So excessive weight can contribute to health risks, increased cardiovascular disease, hypertension, arteriosclerosis, decreased life expectancy, poor circulation, increase the risk of diabetes, increased stress on joints. This is why it matters. Weight is also an important factor in maintaining good health, so we want to make sure that in any physical that they're measuring their height and weight and looking at that. Additional vital signs that we can take into consideration would be pain level, so the 1 to 10 pain scale, either visual analog scale. Skin color, is it red, pale, ashen blue? We want to look at that. If it's red, possible heat stroke or high blood pressure. Pale or ashen, possible shock or internal bleeding. Blue, which is cyanotic, means there's a respiratory airway problem, probably obstruction. When I say pearl, so we want to look at pearl. So pearl means pupils are equal and active and reactive to light. Okay, so whenever you've seen doctors shine a light into your eye, they're looking at your pupils. They're looking to make sure it constricts and that they're equal. Okay, so when you shine the light, it constricts, and when you take the light away, it gets larger. So pupils, equal, active, reactive to light. Okay, you're going to look at state of consciousness, and then sensory and strength changes. So tingling, numbness, complete loss, unable to walk. These are all simple overall vital signs.